Good morning, all of you. In today's class, we are going to start with a new unit, that is unit number 4, and it is about research approaches and designs. So, under this unit, we have the subheadings or the content. What we are going to look is one is about historical survey and experimental research, and qualitative and quantitative designs. Let us start with the research approach. So, what is research approach? It is nothing but as a researcher, how you are approaching the research or how you are looking the problem statement or the researchable problem. So it involves the description of the plan to investigate phenomenon under study in a structured, that is quantitative or unstructured or qualitative or a combination of both methods. That is called sometimes mixed method research. It involves both quantitative as well as qualitative. And there is a difference between these two approaches also, quantitative and qualitative. I'll tell you in the future slides. It helps to decide about the presence or absence as well as manipulation and control over variables. So this approach only will help the researcher, because when we conduct research, we have to control some of the variables. Variables are nothing but something that varies according to the situation. It varies, and sometimes it influences your research problem and may influence your research results also. So in that case, we may have to control the variables under control or under study in order to get appropriate results. Okay? So research approach is nothing but it involves a description of the plan to investigate the phenomenon under study. Right? How you are going to approach your problem statement or how you are going to investigate it, whether it is a quantitative or it is a qualitative. In quantitative is nothing but the data whatever you are collecting will be in numerical form. That is 1, 2, 3, that numerical data you may have, whereas in qualitative it is only the descriptive statements you are collecting from the samples. Okay, there is a difference between quantitative and qualitative. And specifically, if you want to see what is quantitative research approach, quantitative approach emphasizes objective measurements. That is, as a researcher, your objective measurements and the statistical, mathematical, or numerical analysis of data collected through polls, questionnaires, and surveys, or by manipulating pre-existing statistical data using computational techniques. So what you have to understand here is when you are using quantitative research approach, this approach is a objective measurement, which means you want to, as a researcher, it is not a subjective measurement, it is an objective measurement. Subjective is related to the samples and objective is related to the researcher. So you are collecting the data in the numerical form, and that you are applying some statistical calculations or mathematical formulas you are applying, or you are analyzing the numerical data which you have collected from the samples. And you can use different tools also. It may be through polls, or you can use some questionnaires also, and you can conduct some surveys through which you are collecting your numerical data or quantitative data. And sometimes what happens, already the statistical data is available, and by manipulating those data we are coming to the conclusion. That is also possible, but still it is the numerical data which you are collecting. So quantitative research approach is simply means that you are approaching the samples in order to get some numerical data as your information, right? So the information what you are going to collect will be in numerical form and can be collected through polls, questionnaires, and surveys, or by manipulating the pre-existing statistical data, right? This is about quantitative research approach. And if you see quantitative approach, again it is divided into three. One is inferential approach, experimental approach, and simulation approach. Okay. And furthermore, if you want the clarification, generation of data in quantitative form, which can be subjected to rigorous quantitative analysis in a formal and rigid fashion. Okay, so any numerical data if you're collecting, that is simply called quantitative approach, and it has some classification also. It may be sometimes inferential approach or experimental approach or simulation approach. Let us see one by one what is this. So the first one is inferential approach. Inference is nothing but it is you are coming to the conclusion. Okay. Overall conclusion, that is inference. You are drawing some conclusion out of your research. So the purpose of inferential approach to research is to form a database from which to infer characteristics or relationship of population. So this we can say that in all the disease conditions we are writing the incidence rate, right? Incidence rate of the disease among males or among females. These are drawn out of this inferential research approach only, right? Because the conclusions are drawn based on this quantitative approach, and very particularly they have conducted the research by inferential approach. Okay, that gives a conclusion on some aspects. This usually means survey research where a sample of population is studied, questioned or observed to determine its characteristics, and it is then inferred that the population has the same characteristics. Inferred in the sense conclusions. You are concluding that yes, this population had these are the problem, or among this population males had these issues and females had these issues. You're coming to the conclusion, especially that happens by survey method. You are questioning the samples or you are observing a group of population. Okay, finally you are coming to the conclusion, that is called inferential approach. In order to come to the conclusion, your approach will be inferential, or especially it is quantitative approach. Second is about experimental approach. Experimental approach is characterized by much greater control over the research environment, and in this case some variables are manipulated to observe their effect on other variables. Experimental is purely experimental, which means we have independent variable and a dependent variable, right? For example, if you are giving some intervention, health education you are giving to the samples. Okay, health education we are giving in order to increase the knowledge of the sample. So here health education is an independent variable and the knowledge of the samples is the dependent variable, right? So we have independent variable and dependent variable. So we are giving this independent variable in order to see the outcome in dependent variable. So after health education and before health education, if you assess the knowledge, definitely before health education it may be less, and after health education the knowledge is somewhat increased, right? This is called experimental approach. Here what we have to do is we have to do some control over the other variables, which means the research environment where we are conducting. For example, if you are conducting the research, you are giving health education on diabetes mellitus to the samples. How we are controlling here? If the samples are already they have attended the sessions on diabetes mellitus, definitely you cannot have any proper results. So you have to exclude those samples, those who have already attended the sessions, right? So that is called control. So the research environment is only for the samples those who have not attended any sessions on diabetes mellitus, which will give you the clear results. So they will be exposed to pre-test, then intervention, then post-test. And if you are assessing the knowledge by pre-test and post-test, definitely there would be some differences in the knowledge level of the samples, right? This is purely experimental approach. And third one is called simulation approach. It involves the construction of an artificial environment within which relevant information and data can be generated. So this permits an observation of the dynamic behavior of a system or its subsystem under controlled conditions. Simulation approach is nothing but we are observing the population in a controlled environment, right? Say for an example, your classrooms. Okay, when you are inside the classroom, if I want to assess your behavior, how the students are behaving inside the classroom, then I can say that yes, it is a controlled or artificial environment which is created to observe the students' behavior, or laboratory setup we can say, right? So we can make the model of that environment, and it is called the artificial environment where we are going to conduct the research, right? It will give you the exact setup of the original matter, right? So this is, it permits an observation of the dynamic behavior, which means continuously changing behavior of the system under controlled conditions. Because we know that there is a difference between the presence of teacher in the classroom and absence of teacher in the classroom. Based on that, the behavior of students changes. When the teacher present inside the classroom, and the students will show appropriate behavior. When the teacher is not there, their behavior will be changing, right? So there is a difference. So if I want to assess this behavior among the students, then I can go for this simulation approach, or artificial environment I can create and I can observe the students' behavior, how it is changing dynamically. Okay, so this is simulation approach. So under quantitative approach, we have three things, and next let us see about qualitative approach. Qualitative approach, it is a subjective assessment of attitudes, opinions, and behavior. So the difference you have to understand here, I told you, quantitative approach is a objective assessment, or it is the assessment of the researcher. Here, qualitative is a subjective assessment, which means it is concerned with the samples, their own attitudes, their own opinions, and their behavior. Okay, there is a difference. Research in such a situation is a function of researchers' insights and impressions. Such an approach to research generates results either in non-quantitative form or in the form which are not subjected to rigorous quantitative analysis. So it is purely a qualitative approach where it does not include any numerical analysis, or there is no quantitative analysis applicable to this qualitative approach. So generally the techniques of focus group interviews, projective techniques, and in-depth interviews are used. So qualitative approach, if you are conducting the research on assessing attitude of the sample, there you are going to conduct face-to-face interviews or focus group interviews, or you are conducting some projective techniques. This you must have studied in psychology, projective techniques, the storytelling, sentence completion. So all these things are the examples of these projective techniques where you are conducting in-depth interviews, right? So qualitative is always it's a matter of assessing the client or the samples in depth manner. Okay, their attitudes, their opinions, their behavior, everything will be assessed in depth manner, which will give you some declarative statements or descriptions about the particular phenomenon. So there you are not going to apply any quantitative analysis or numerical analysis, which is not at all applicable to qualitative research. Okay, so let us start with the research designs. So far we discussed about the research approaches. There are two approaches, quantitative approach and qualitative approach. And under quantitative, we have three: inferential, experimental, and simulation approach. And qualitative, it is a subjective assessment where we are assessing the attitudes, opinions, and lived experiences and behavior of the sample. Now, this is about research designs. So what is research design? It is a master plan specifying the methods and the procedures for collecting and analyzing the needed information in a research study. Okay, so research design is the master plans about your research, what you are going to conduct, and the methods and procedures for collecting and analyzing the needed information in a research study. How you are going to collect data, and what are the procedures you are going to follow in order to meet the samples or sampling criteria, and after collecting data, how we are going to analyze it. So all these informations will be there in the research design. Okay? It's a blueprint, we can say simply, or it is a master plan of your overall research. So research design is the plan of how, when, and where data are to be collected and analyzed. So you are writing in your research design about how you are going to conduct the research, when you are going to conduct the research, and where data are to be collected, and how you are going to analyze the data which are collected from the participants. Okay, so these informations are covered in research design. And another description is that research design is the researcher's overall plan for answering the research questions or testing the research hypothesis. Okay, sometimes what happens, you have a research problem or the statement, and for which you are looking for the answer. Okay, at the end, you are coming to the conclusion and you are saying that yes, this is a solution for this problem, or you have the hypothesis which you are testing. One example I can say that as I told you, pre-test and post-test you are conducting. So you are assessing the knowledge of the participants on some aspect. Say for an example, diabetes mellitus. Okay. So you want to prove that your hypothesis will be there will be a significant difference between pre-test and post-test knowledge score of the samples. And how you are going to prove it? You are giving interventional program. That is called you are giving health education to the samples. And when you are assessing pre-test, definitely there is lack of knowledge among the participants, and after assessing pre-test, the score is less among the participants, and immediately you are giving health education on diabetes mellitus, and with the same questionnaire which you have used for pre-test, you are using for the post-test also. After intervention, after giving health education, definitely the samples must have learned something because of your health education program. Now, when you give the same questionnaire again, definitely they can answer more answers they can give. So that is the meaning, or that is an indicator that they have gained knowledge out of your health education. That is a progress you can say. Okay, so you are proving that yes, health education program was effective and was useful, and it is proved that the knowledge level is more among the samples in post test than the pre-test knowledge. Okay, so this is about testing the hypothesis or answering the research questions. Okay, so it doesn't, it means that research design is the overall plan of the researcher, how, when, and why, how we are going to conduct the research. And we have some elements also in order to conduct the research. As I told you, it starts with approach. It may be quantitative approach or qualitative, or sometimes it is a mixture of both, or without a conceptual framework. Conceptual framework is your concept related to the study, how you are going to conduct it, what is your concept, okay, among the study, and method of analysis, how you are going to analyze the data, population, who is your population, who is your sample, and sampling technique, how you are going to select your samples from the population. Okay, and the tools or methods of data collection, as I told you, whether you are using survey or questionnaire or interview, that are tools which you are going to collect data from the samples, and time and place of data collection. These are the common elements which we are using while conducting research study. Okay, elements, it starts with always the approach, because without choosing your approach you cannot proceed further for your research conduction. You have to be very clear whether your research is a qualitative approach or quantitative approach, then it moves with the designs. And you are adding whether without or with conceptual framework, then you are choosing a population, then sample, sampling technique, and output. Okay, now let us see factors affecting selection of research design. So we may be confused sometimes how to select the research design, and there are some factors which influences and which affects your selection process about your research design. Okay, one is nature of the research problem. So this is whether it is a experimental research, or it is a descriptive research, or it is only conducting simple survey. Based on that, your research design will be chosen. And second is purpose of the study. Purpose may be different. As I told you, it is sometimes you are using quantitative approach or qualitative approach. Even quantitative also, it is experimental research comes under quantitative only. The purpose is what? Whether you want to have some answer at the end of the research, or you want to draw some conclusions at the end of the research. Based on that, your research design will be selected. Then researcher's knowledge and experience. It is most important in order to carry out any research. Okay, you must have the basic knowledge of the research, and at least some experience you must possess before conduction of the research. Either you must have attended conferences, seminars on research aspects, or presented some papers, or presented some journal club presentation you must have done. So like this, some experiences you must have. Then researchers' interest and motivation. It is a vital part of conducting research, because no one can conduct research without their own self-interest and motivation, right? So if you have a problem in your hand and you're looking for the solution, definitely you can make it as a researchable question and you can go for the research. Then research ethics and principles. This is about, sometimes it is applicable to the experimental research. We have to protect the samples, and we have to, respect the samples, and we cannot treat them as a, just like that human being. They are our samples, and we have to respect them, and we have to treat them. Their cultural and ethical, religious values must be respected when you're choosing the samples, and you cannot force any samples to be included as a study sample in your study. And they have some rights also. They can withdraw from the research at any point of time if they are not interested. And if something happens to them in between, during the conduction of the research, then the researcher is responsible, and we have to make sure that there is no harm possible for the participants during the conduction of the study. Okay, so for that we may have to take ethical approval from the concerned committee or concerned department before conduction of the research. So these are the ethics and principles has to be followed sometimes. And subjects and participants, the samples from where you are choosing. Sometimes you may have a problem, but choosing the samples are very difficult. Say for an example, if you are interested in conducting the research on AIDS patients, but getting the patients with AIDS or HIV, it is very difficult. Okay, so you may not get adequate number of samples in order to carry out the research. Okay, and you may have to spend a lot of time in searching samples itself, and it may prolong your research time also complete the research process. Then resources. It is nothing but fund or manpower which you need to collect data, and the budget which you need to complete the research process. Sometimes researchers one fund is used and it is not sufficient to complete the research. So that you are limiting your areas or you are restricting your samples sometimes. So that the results what you are going to get is not fruitful. Okay. Then time. So time is nothing but how long you are going to conduct the research. It is a 1 year study or 6 month study, or it is a short study, or it is a long study, or in research terms, if you want to say, it is a longitudinal study or it is a cross-sectional study, right? So based on that, your research design also will be chosen. Okay, again, it is based on your research problem time. Maybe it is a cross-sectional design in the sense you want to assess the patients or the samples only once, then your study will be completed and you are not going to approach your samples for the second time. Whereas longitudinal, you are in continuous touch with the samples for years together, maybe 1 year, 2 years, or 3 years continuously you are assessing or you are observing the samples. Okay, that is a difference. Yes, so these are the factors affecting selection of research design. Next, let us see types of research designs. We have two types: quantitative research designs and qualitative research designs. As I told you, it is again based on the approaches, either it is a quantitative approach or qualitative approach, and based on that the research designs also, sometimes it is quantitative or it is sometimes qualitative. So let us see now the sub-classifications under each research design type. The first one is quantitative research design. We have three different types of quantitative research designs. One is experimental, second is non-experimental, and third one is other additional research designs. So under quantitative research design, we have experimental, non-experimental, and other additional research. Again, under experimental, we have one is true experimental. Under true experimental, we have post-test only control design, pre-test, post-test control group design, Solomon 4 group design, factorial design, randomized block design, and crossover design. Okay, under true experimental, we have 6 different types of research designs: post-test only control design, pre-test post-test control group design, Solomon 4 group design, factorial design, randomized block design, and crossover design. This is the first type, true experimental. Second is quasi-experimental. Under quasi-experimental, we have other two types. One is non-randomized control group design and time series design. Non-randomized control group design and time series design comes under quasi-experimental design. And the third one is pre-experimental. Pre-experimental design, again there are two classifications: one short case design and one group pre-test post-test design. Okay, so these three are the experimental research design types. One is true experimental, second is quasi-experimental, and third one is pre-experimental. Under each category, then we have subtypes. Okay, so let us start with the true experimental designs first. So true experimental is nothing but the researchers have complete control over the extraneous variables and can predict confidentiality. Can predict confidentially that the observed effect on the dependent variable is only due to the manipulation of the independent variable. So here we have to understand some of the terminologies like variables. As I told you, variables is the thing that varies according to the situation, right? And as I told you, we have independent variable, dependent variable, and extraneous variable. So let us see one by one what all these means. Dependent variable. Dependent variable is the outcome being measured, the effect in a cause and effect relationship. The common example, if I want to say, I can say smoking causes lung cancer. Okay. Here, smoking is an independent variable and the lung cancer is a dependent variable. So lung cancer depends on the smoking factor. Here we have two things: independent variable and the dependent variable. Dependent variable is the outcome. Lung cancer is the outcome. If the person is smoking continuously, definitely it will end up with lung cancer, right? So if you want to assess the outcome, then we have to take the samples as smokers. If you are conducting the research on smokers, definitely you can get the result whether it ends with lung cancer or not. Okay, this is dependent variable. So dependent variable is nothing but it is the outcome of the particular cause, or you can say it is a cause and effect relationship. The outcome will be the dependent variable, right? Second is independent variable. Independent variable is a variable that is explicitly included in an experiment because the experimenter believes it is a potential cause in a cause and effect relationship. So independent variable is nothing but as a researcher we introduces. It is a potential cause we can. As I told you, health education improves the knowledge of the sample. So health education is an independent variable, right? Because we are introducing this independent variable and we can something manipulate the independent variable also. Okay, so if the independent variable is administered, definitely you can assess the outcome, that is dependent variable. Example here I have given that a scientist studies the impact of a drug on cancer. Here the independent variables are the administration of the drug, the dosage and the timing are the independent variable, whereas the dependent variable is the impact the drug has on cancer. Effect or the outcome which produces on cancer is considered as dependent variable. Right? This is independent and dependent variable. And the third one is extraneous variables. So the extraneous variables are nothing but variables that you are not intentionally studying in your experiment. It could affect the dependent variable. And then what happens? Our focus or the researcher's focus is only about independent variable and dependent variable. And additionally, there are some variables which may affect your study results also, that is considered as extraneous variable. And there are different types of extraneous variables. I have mentioned here 4 different types. One is situational, participant, or person variable, experimenter or investigator variables or effects, demands characters. These 4 are the different types of extraneous variables. So let me tell you what are these things. Situational variable. So these are aspects of the environment that might affect the participants' behavior. Example, noise, temperature, lighting conditions, etc. Situational variables should be controlled so they are the same for all participants. Okay, so if you want to assess the temperature of a group of people, then definitely you must have the control over the atmosphere. Okay, because each person's body temperature will be having some minor changes, but when they are exposed to a similar condition, it should be common for everyone, right? So situation variable is the environment. Example I have given you that noise or temperature, lighting conditions, and it also sometimes affect your study results, especially when you are assessing the temperature of the client or the samples, or when you are assessing the visual capacity of the pupils like this. So the lighting conditions or the weather conditions or the atmospheric conditions may affect your research findings if you are not controlling the environment. This is called situation variable, comes under extraneous variable. But actually you are not studying about the environment. Okay, it is not at all your concern. But if you are not controlling the extraneous variable, definitely it will interfere with your study findings. That's why you are controlling the extraneous variable. Second is about participant or person variable. It is about the samples or the study participants which you are including in your study. This refers to the ways in which each participant varies from the other and how this could affect the results. That is based on the mood of the person, intelligence or anxiety or concentration power of the person. Okay, so the intelligence and the anxiety, it varies from person to person. So when you're choosing the sample, especially when you're assessing the intelligence or conducting some educational interventions on the samples, then all must have equal intelligence or all must be having same level of anxiety. So such a person you have to select it. Then only the research outcome will be appropriate or valid. Otherwise, you may get false results also if you are not controlling this participant person variable. The next one is experimenter or investigator effects. It is based on the researcher. Okay, the experimenter unconsciously conveys to participants how they should behave. This is called experimental bias. So this is an expectation of the researcher during the conduction of the study. Okay, so this is actually we should not disclose what we are expecting from the sample, right? You can say that the procedure how it is conducted, but the outcome what you are expecting you should not disclose to the sample. Okay, so if you're disclosing the outcomes which you're expecting to the samples, then the samples definitely will react according to your expectation. Then there you are making or creating bias. Okay, so the experiment might do this by giving unintentional clues to the participants about what the experiment is about and how they expect them to behave. This affects the participants' behavior. Definitely, it will affect the behavior of the participants, and they may behave according to your expectations. That gives some wrong results. Okay, so also the personal attributes like age, gender, accent, manner, etc. of the experimenter can affect the behavior of the participants, right? So simply it means as a researcher, you should not disclose what is your outcome you're expecting. Okay, your expected goals, you should not say that. But the purpose of the study can be explained. But the outcome, what you want exactly from the study or at the end of the study, should not disclose whether it is positive or negative. Let it be natural. Okay, you should not expect from the samples or you should not give any clues or hints to the samples which may affect your study results. Yeah, and the fourth one is about demand characteristics. Demand characteristics is also similar to this experimenter expectations only. These are all the clues in an experiment which convey to the participant the purpose of the research. Demand characteristics can change the results of an experiment if participants change their behavior to conform to expectations. Okay, demand characteristics nothing but it is the demand of the researcher. Okay. For example, as I told you, while giving health education, you are expecting the samples to show increased knowledge by post-test, whereas pre-test knowledge is less. So you are giving health education to the samples, whereas you are proving that post-test knowledge is higher than the pre-test. Okay, this is your expectation, but sometimes it is not possible. After giving health education, also sometimes the knowledge level is the same. It is not improved or there is no changes. Then in that case, if you are telling the samples, yes, I want to assess your knowledge, and definitely you have to show increased knowledge after postage, after giving health education. If you say in that way, they may act according to your purpose, or they may act according to your demand or the expectation. Okay, which will give some or samples. Sometimes they may do copy paste also, or they may ask somebody and they may put tick mark also in the right answer. So they will try to make up your expectations, or they will try to fulfill your demands, which you are unintentionally or intentionally you are declaring to the participants. Okay, that should not be. So these all things are comes under extraneous variables. So you have to control all the extraneous variables, especially when you are conducting experimental research. Okay. Yes. So these are about the variables or the different terminologies what we are using in the research: dependent variable, independent variable, and extraneous variable. For the demand characteristics, one example I have given here. One is suppose we wanted to measure the effects of alcohol, that is intravenous, on driving ability. We would have to try to ensure that extraneous variables did not affect the results. These variables could include, see, suppose we want to measure the effects of alcohol intravenously, which is administered in order to know the driving ability after consuming alcohol. So we have some extraneous variables can affect your research study here. Those variables are, one is familiarity with the car. For example, some people may drive better because they have driven this make of car before. Okay, so they have their own car and which is of the similar model, which is similar makeup, so they can manage well while even if they have consumed alcohol also. This is one extraneous variable. Familiarity, then familiarity with the test. Some people may do better than others because they know what to expect on the test. Okay, so some people they know what they are expecting. Researchers' expectations they know, so though they may act according to the expectations of the researcher. Again, it will give false results. Then used to drinking. If the person you're choosing as a sample in your study is already drinking alcohol, so there won't be any differences. Again, you are including him as a sample in your study and you're asking him to consume alcohol. So there won't be any effect because already he is used to drinking, right? So when you're choosing the sample, such a people should be excluded. You have to have control over these people, right? So then you're conducting or you're selecting the right person for the study as a sample. Then full stomach. The effect of alcohol on some subjects may be less than on others because they have just had a big meal. So if you're not concentrating or if you're not controlling this food pattern or food matter, definitely which will interfere with the results because some are already had full meals, then they are consuming alcohol, then the effect will be lesser. than the samples who they consume the alcohol in empty stomach. There is a difference, right? So which will give again false results. So these are some of the extraneous variables affect the study results. So before conducting the research, the researcher must control all these extraneous variables in order to get proper results. Okay, so with this, I will complete today's session, and the rest of the topic will continue in the next class. Thank you for joining. Now you can send your messages and name to the chat box for attendance purpose.